Welcome to the Educated Choices Program's presentation, From Farm to Flu, Public Health and Pandemic Prevention. Today we will be learning about the relationship between animal agriculture and disease, and what daily choices we can make to work towards a healthier and more sustainable future. Disease is an everyday part of our lives. From hand washing to medical interventions, we have a variety of protective measures to help stop the spread of disease. While seasonal illnesses such as the flu are commonplace and preventable, the rise of pandemics like COVID-19 has created new challenges. Research shows that the risk of intense disease outbreaks like COVID-19 is growing at a rapid rate. A 2021 study estimates that the probability of an extreme epidemic could triple in the coming decades. While these numbers are alarming, we can make a difference through our food choices. Did you know that the food we eat has a large impact on animals, our environment, and even public health? By making conscious food choices, we can take meaningful steps to create a healthier planet for us all. To enact this change, we must first look at how animals and diseases are related. Throughout history, humans have been affected by zoonoses. Zoonoses are infectious diseases that have passed from an animal to humans, either through direct contact, food, water, or our environment. There are over 200 known zoonoses, and a large percentage of newly identified and existing infectious diseases are zoonoses. If you have an animal companion at home, whether they're a dog, cat, or even a ferret, you might have heard of rabies before. Rabies is an example of a zoonotic disease. In the case of rabies, the disease is transmitted through direct contact, such as a bite, scratch, or lick. Some other examples of zoonotic diseases include the Spanish flu, MERS, and Ebola. The Spanish flu was a pandemic that began from a bird host. From 1918 to 1919, the flu infected around 500 million globally. That was 33% of the world's population at the time. MERS, or Middle East Respiratory Syndrome, transmits from camels to humans, with most transmissions having been reported in the Arabian Peninsula. Ebola disease is caused by a group of viruses, which can be transmitted from contact with an infected animal, like a bat or primate. The food we produce plays an important role in the emergence of zoonoses. Think back to the last meal you ate. Did it include any animal-based products, such as meat, dairy, or eggs? Animal products are in high demand, and we don't often think about where our food comes from. But to meet this demand, we have to raise a lot of animals. Can you guess how many farmed animals are raised globally every year? Since 1961, total global meat production has more than quadrupled. In 2022, 79 billion birds, including chickens, ducks, and turkeys, and over 2.6 billion pigs, cattle, sheep, and goats were killed for food, totaling over 81.5 billion animals killed that year alone. Most livestock are raised on large-scale industrialized farms called concentrated animal feeding operations, also known as CAFOs. These facilities hold a large number of animals crowded into confined spaces. In 2017, an estimated 99% of livestock in the United States came from industrialized farms. In 2020, there were 21,465 CAFOs in the United States. Animals in these facilities are restricted from many of their natural behaviors, such as foraging for food, grooming, and creating social communities. Plus, so many animals means there is a large amount of feces and urine produced. These overcrowded and unsanitary conditions, with limited airspace and waste removal, have increased the spread of zoonotic diseases. In an attempt to stop the spread of diseases, animals, humans, and even crops are given antibiotics. Antibiotics are drugs that kill bacteria and stop their growth, and are used to prevent and treat infections caused by specific bacteria. In addition to disease prevention, antibiotics have been previously given to farmed animals to increase efficiency and profit. In the 1940s, antibiotics prescribed at lower levels were found to promote growth in farmed animals. This practice was banned in 2006 in the European Union, and in the United States, it was banned in 2017. That same year, the World Health Organization reported that in some countries, around 80% of antibiotics that are important to human medicine were used in animals, mostly for growth promotion in animals that were otherwise healthy. Why would this practice be banned, and why does it matter? Antibiotics are intended to be prescribed when deemed medically important, such as with bacterial infections that can spread from one person to another, are unlikely to clear up on their own, or carry a risk of more serious complications. However, when antimicrobial medicines are misused or overused, germs are more often exposed to the drugs that are designed to kill them, and they evolve over time to no longer be affected by the drugs. This process is known as antimicrobial resistance. Antimicrobial resistance, or AMR, is when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial medicines, including antibiotics. According to the World Health Organization, as a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective, and infections become difficult or impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. The antibiotics used in livestock can be found in the animal products we eat. Plus, antibiotics spread into the soil and water through contaminated animal waste, which can enter the environment through manure-based fertilizers, waste disposal methods, runoff from facilities, and even dust from farms. When we ingest these unnecessary antibiotics, we increase our antimicrobial resistance. Antimicrobial resistance is listed by the World Health Organization as one of the top global public health and development threats, and claims that this problem threatens the achievements of modern medicine. An estimated 1.27 million global deaths were directly caused by bacterial AMR in 2019, and it contributed to 4.95 million deaths the same year. Even after the ban on the use of antibiotics for growth promotion, in 2019, over 25 million pounds, or nearly 11.5 million kilograms of antibiotics were given to farmed animals in the United States, increasing the size and density of livestock populations to meet growing demands, makes disease transmission easier. Additionally, the expansion of industrial agriculture alters habitats, resulting in a loss of biodiversity, or the variety of living things that are able to survive in those locations. This loss of biodiversity means the remaining animal species likely have a very similar genetic makeup, potentially making them more susceptible to disease. Industrial agriculture also increases human and animal interactions, including contact between livestock and wild and domesticated animals, which can increase the risk of transmitting zoonotic diseases. The conditions of our intensive animal agriculture system have led to a variety of zoonotic outbreaks. Let's do an activity to identify some of these zoonoses. See if you can match the zoonosis to its associated animal and the primary location for its outbreak. The zoonoses are bovine spongiform encephalopathy, or BSE, swine influenza, and avian influenza. Hint: BSE is also known as mad cow disease. The animals are pigs, cows, and birds. Finally, the locations are the United States, the United Kingdom, and worldwide. Now, pause this video and see if you can unscramble the zoonoses. Ready? Let's see how you did. BSE, or mad cow disease, is found in cows, and its outbreak was centered in the United Kingdom. It's a fatal brain disease, and scientists believe it was caused by feeding cattle infected animal products from cows or sheep. While the outbreak did primarily impact the UK, it also affected 24 other countries. BSE can cause a secondary fatal brain disease in humans, although it is very rare, with around 230 cases identified since 1996. Next, swine influenza. This disease causes regular outbreaks in pigs, and in 2009, there was a pandemic declared by the World Health Organization. So the correct choice is that it had a worldwide impact. Before this pandemic, swine influenza had never been identified as causing disease in humans. By the time it was declared a pandemic, 74 countries and territories had reported infections. That leaves us with avian influenza, originating in birds, and its outbreak centered in the United States. This outbreak killed over 50 million farmed birds in 2015, primarily chickens and turkeys. More recently, in March 2024, the United States Department of Agriculture reported the first instances of avian influenza in dairy cows. The first human infection following that was in April 2024. To prevent zoonotic outbreaks such as these, an emergency measure called depopulation is used. The United States Department of Agriculture defines depopulation as a method by which large numbers of animals must be destroyed quickly and efficiently, with as much consideration given to the welfare of the animals as practicable. One method of depopulation is ventilation shutdown, known as VSD. A large number of animals are placed in a confined space, where ventilation is cut off, and sometimes heat or carbon dioxide is added. The animals die from heat stroke, which research suggests causes severe suffering. In 2022, VSD was used to kill millions of chickens, turkeys, and ducks infected with avian influenza. During the COVID-19 pandemic, hundreds of thousands of pigs were killed. VSD has not only been used for disease prevention. In the United States, thousands of swine and poultry were killed in April 2020 due to labor shortages caused by COVID-19 outbreaks in slaughterhouse workers. The zoonoses we covered previously are examples of the impacts our animal agriculture system has on public health. As seen in the case of swine and avian influenza, zoonoses have epidemic and pandemic potential. In an increasingly connected world, we face more risk for the international spread of zoonotic infections through avenues like trade and travel. Zoonoses can also have high fatality rates compared to the rate of cases, and the lack of specific vaccines and treatment can make it difficult to manage their spread. Some communities are more vulnerable than others to zoonoses. Those living in poverty and in poor countries face greater risk because of greater contact with animals and reduced access to resources like clean water and sanitation. Slaughterhouse workers also face increased vulnerability. In slaughterhouse plants, hygiene practices are focused on food safety and the risk of zoonotic disease rather than disease spread from person to person. Workers in the processing line work in very close proximity to each other, thus increasing their risk. In addition, there is evidence of vulnerable conditions such as low pay, lack of sick leave and affordable health care, and high density and low quality housing, all of which can contribute to the further spread of disease in communities. Using COVID-19 as an example, over 16,000 cases and over 85 deaths occurred by May 2020 among over 230 U.S. animal processing facilities. Finally, communities living near industrialized animal farms face elevated risk for health issues, including respiratory issues, negative moods and stress, and infections with zoonotic pathogens. Another public health impact caused by zoonoses is foodborne illnesses. The World Health Organization estimates that every year, unsafe food causes 600 million cases of foodborne disease and 420,000 deaths globally. An estimated 33 million years of healthy lives are lost globally every year due to the dangers of unsafe food, and this number is likely an underestimation. Not only do zoonoses impact our health, but also the health of our environment. Let's think back to what we learned about CAFOs. These facilities hold a large amount of animals, which also means a large amount of waste. Animal waste is kept in storage facilities like waste lagoons, which are prone to leaking or spilling over. Manure can also be sprayed onto fields as a disposal method. This leads to dangerous pathogens and antibiotics becoming airborne, impacting crop production on land and spreading to waterways, harming aquatic ecosystems. For example, the Environmental Working Group conducted an analysis of North Carolina hog farms and discovered over 4,000 lagoons covering nearly 7,000 acres. 170 of those lagoons were within a floodplain, and 136 were within half a mile from a public water well. This can also affect surrounding communities, which can suffer from acute and chronic health impacts from drinking or being in contact with contaminated water. Let's recap what we've learned about the relationship between zoonoses and animal agriculture. In 2022, more than 81.5 billion land animals were killed for food, and we've explored the widespread impacts of our animal agriculture system on our health and environment. Our industrialized animal agriculture system is overcrowded and unsanitary, leading to many public health issues. From zoonotic pandemics to antimicrobial resistance, it is unsustainable, as drastic measures like depopulation have killed thousands and even millions of animals during zoonotic outbreaks. The public health and environmental impacts also do not affect people equally, with those living in poverty and poor countries, slaughterhouse workers, and people living near industrialized animal farms experiencing the most vulnerability. These disproportionate impacts emphasize the importance of addressing this issue. Now that we know these impacts, what choices can we make to prevent them? The United Nations identifies the top 3 drivers of zoonotic diseases as increasing human demand for animal protein, unsustainable agricultural intensification, and increased use and exploitation of wildlife. These drivers are all directly linked to our consumption of animals. According to the Eat Lancet Commission, most studies have concluded that a diet rich in plant-based foods and with fewer animal source foods confers both improved health and environmental benefits. Their science-backed Planetary health diet emphasizes a plant-forward diet with whole grains, fruits, vegetables, nuts, and legumes. In addition to helping reduce the reliance on animal products and therefore reducing the risk of zoonoses spreading, the Commission estimates that the universal adoption of such a diet would help avoid severe environmental degradation and prevent around 11 million human deaths annually. Organizations, programs, and policies that encourage plant-based diets can have significant impacts. C40 is a global network of around 100 mayors of leading cities focused on taking action to fight the climate crisis. The C40 Food Systems Network supports cities in implementing sustainable and equitable food policies, including implementing the Planetary health diet. Cities that have committed include Barcelona, London, Lima, Los Angeles, Quezon City, Milan, New York City, Seoul, and Tokyo. Another initiative is Denmark's Plant-Based Action Plan. Released in October 2023, the plan outlines ways that the country can live more sustainably through plant-based foods. The plan begins by stating, if we want to reduce the climate footprint within the agricultural sector, then we all have to eat more plant-based foods. Its initiatives include providing funds to professional kitchens to switch to organic produce, helping plant-based startups, and even developing chef training to focus on plant-based foods. Moving away from industrial animal agriculture provides countless benefits, including reducing pandemic risk. Denmark's plan can act as a model for other countries, inspiring more sustainable food systems. While it can be difficult to imagine widespread dietary changes, history shows that dietary patterns and trends change significantly, even within generations. According to the World Health Organization, the production, distribution, and consumption of animal-based products, such as meat, dairy, and eggs, is a major risk for zoonotic transmission. Therefore, our perspective is that promoting sustainability, particularly by reducing unsustainable animal-based consumption, must be part of the broader response to reduce the risk of future pandemics. To make sustainable food choices, we need to think critically about the conditions in which our food is produced. While plant agriculture still uses antibiotics, its use in plants is considered relatively low compared to that used in human and veterinary medicine. In 2021, the EPA and USDA estimated that antibiotic use in fruit orchards amounted to less than 0.4% of the total amount used in animal agriculture during the same period. Antibiotics are only active on plants for less than a week, and no significant residues have been found on the fruits. Antibiotics are applied when there is a high disease risk, and so a majority of these orchards are also not treated annually. As we have learned, less antibiotic use and residue means less antimicrobial resistance. Shifting to plant-based foods can reduce our risk of developing this resistance. Another way to avoid antimicrobial resistance is through eating foods that are good for our microbiome. Your microbiome consists of many types of microbes that coexist in a healthy body. These microbes can provide protection from pathogens in contaminated water or food. Overall, plant-based diets were found to have beneficial effects on our gut microbiome. Examples of foods that are beneficial to your microbiome include vegetables, beans, whole grains, and fermented foods. Plant-based foods, especially in their whole natural forms, were also found to have typically lower price tags compared to most protein foods. Canned and frozen vegetables and fruits are also affordable and nutritious ways to incorporate a plant-based diet. What we may not often think about, though, when considering the cost of food, are the external costs of these products, or a cost not included in the market price of the goods and services being produced. In other words, these are costs that are not included in the products we buy, such as environmental and public health costs. While the negative impacts caused by industrialized animal farming can be considered external costs that are not reflected in the price of meat, dairy, or eggs, it is estimated that pandemics cost the global economy $500 billion United States dollars during outbreaks, so these costs carry a huge weight. With the increasing urgency and scale of the issue of pandemics, it can feel like an overwhelming problem to tackle. It can be hard to know where to start. But the foods we raise, grow, and eat have global effects. Luckily, as consumers, we can have an impact. The World Health Organization has identified that the need remains to bring individual consumers into the conversation so that they are informed about the evidence and what actions they can take to prevent the spread of zoonotic diseases. We, as individuals, can make choices to help our planet and public health by adopting more plant-based foods in our diet. This can also reduce our antimicrobial resistance and the harmful pathogens in our environment. With knowledge of how zoonoses emerge, we have real power to create change. And any change, no matter how small, can still make a difference. By incorporating plant-based foods into our diets, we can have a significant impact on our public health and the environment. If hundreds of people made the choice to incorporate a plant-based diet, the effects would be far-reaching. By taking these steps, we can begin to create a healthier, more sustainable world. Want to learn more about the topics we discussed today? Check out the Educated Choices program's Next Steps Toolkit by scanning the QR code or by visiting www.ecp-toolkit.org. In it, you will find recipes, recommended documentaries, inspirational people, and more. Remember, you viewed From Farm to Flu, Public Health and Pandemic Prevention today. Thank you for watching.